Now coming to apoptosis. Apoptosis is a type of cell death that is induced by a tightly regulated suicide program in which the cells destined to die, they activate the intrinsic enzymes that degrade the cell's genomic DNA and nuclear and cytoplasmic proteins. Basically, the apoptotic cells, they break into plasma membrane bound fragments called the apoptotic bodies, which contain the cytoplasm and the nucleus. So from the cell, there is formation of these bodies by fragmentation, which contain both the cytoplasm and the nucleus. Okay, while the plasma membrane remains intact, its surface components are altered so as to produce find me and eat me signals. So see here, the membrane is intact and there is formation of these apoptotic bodies, but these, the receptors on these surfaces and the surface components are so much altered so that they can undergo phagocytosis. Okay, so they kind of produce this find me and eat me signals. So that is why it is said that the membrane is always intact over here. ठीक है, यहाँ पर कोई इन्फ्लेमेशन नहीं होता है, लेकिन मेम्ब्रेन इतना इंटैक्ट होने के बावजूद भी मेम्ब्रेन के ऊपर क्या होता है, alterations होती है, surface components की alterations होती है, because of which they become targets for phagocytosis. Now apoptosis does not elicit an inflammatory reaction. Very important point. So this is known as the programmed cell death. And what are the important reasons? Now, yes, so as I said that apoptosis can be seen in physiologic situations and in pathologic situations. Examples you can see here, that removal of the supernumerary cells in case during development, involution of hormone dependent tissues on hormone withdrawal, like in case of endometrial cell breakdown during the menstrual cycle, cell turnover in proliferating cell populations like the immature lymphocytes in the bone marrow and all of this, then elimination of potentially harmful self-reactive lymphocytes, the neutrophils, the lymphocytes, all of this, they ultimately have to undergo death. You can't have enormous amount of this keep, in your body. So at some point of time or the other during development, these cells have to die. So that is physiological. Okay, this is important. The cells has to die. It cannot have an indefinite lifespan. In case of pathological conditions, the examples are that, see, very important to understand here is that whenever the cells are injured beyond repair, it is very important that whenever a cell cannot like repair itself and it has lost its function, it is functioning in a dysregulated manner, then it is important that that cell undergoes apoptosis. अच्छा है कि वो मर जाए, ठीक है, वो एग्जिस्ट करना उसके लिए ज्यादा ही बुरा बात है, ठीक है. So apoptosis in pathological conditions, examples are the DNA damage, which the cell triggers intrinsic mechanisms to induce apoptosis, because once there's DNA damage, there is no point if the cell is not being able to repair itself in spite of the p53 mechanisms and all, then there has to be apoptosis, otherwise the cell will start to produce cancer cells, right? Okay, accumulation of misfolded proteins, like for example, that in this ER stress response, I've already explained that ER stress response does come to play whenever there is an accumulation of misfolded proteins. But then again, if that the limit is getting exceeded and this ER response is not sufficient, then the cell has to die by apoptosis. Okay. Then apoptosis can also be induced during certain infections like the adenovirus and the HIV, and also in viral hepatitis. And also please understand and keep in mind that what are the areas where you will find apoptosis is important. Number one is the host response to viruses, which consist of the cytotoxic T lymphocytes. So T lymphocytes or cytotoxic T lymphocyte mediated mechanisms are important in few areas, and this is a very important concept. Question में MCQ में whenever you will find this cell mediated immunity or cell mediated mechanism, then these examples should come into your mind and you should mark that option. Okay, so number one is that whenever there is killing of the tumor cells, okay, number one, when there's killing of the tumor cells, that is happening via this CTL mechanism. Number two, when there's cellular rejection of the transplant, then the point that you need to keep in mind is the CTL mechanism. Then when there's tissue damage in the graft versus host disease, GVHD, ठीक है, यहाँ पर भी जो कि है थर्ड पॉइंट है, दिस इज ऑल्सो हियर ऑल्सो यू आर गोइंग टू फाइंड दैट द मैकेनिज्म इज CTL mediated, ठीक है. एंड ऑल्सो नंबर 4 is the viral protein, any kind of viral protein in the body, when there's a response to the viruses, that also has a role to do with the CTLS. So CTLS are useful in 4 kind of places, in four kind of actions, or reactions or mechanisms in the body. And when you find you, these are very basic concepts. I'm trying to inculcate in you the basic understanding, so that whenever there's a long stem question, what they're trying to ask, if you just know that cytotoxic T lymphocytes are having a role in all of these kind of actions, then it will be easy for you to search from the options, right? Okay. Now coming to the morphology of apoptosis, see, cell shrinkage. As I said over here, that cell shrinkage is the first and most important reaction. So this is important. The cell is eosinophilic and it remains eosinophilic throughout. At the end, oval mass of eosinophilic cytoplasm is only seen here. Okay. Now, chromatin condensation is the most characteristic feature of apoptosis. A very, very, very important question. Okay, which is the most characteristic feature of apoptosis, that is the chromatin condensation. Formation of cytoplasmic blebs and apoptotic bodies. Phagocytosis of these bodies usually by macrophages. There is formation of an intensely eosinophilic cytoplasm with dense nuclear chromatin, and the absence of inflammatory response can make it difficult to detect it by light microscopy. So again, a very, 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 very important point. If you are asked what is better or what can be used to diagnose or to detect apoptosis, it is not going to be light microscopy. It is rather going to be electron microscopy, because light microscopy you can't detect it because there is no inflammation here. So now you just tell me here that whenever there's the word basophilic will be there, then you will write up necrosis, and whenever there's going to be eosinophilic, then the word associated is going to be apoptosis. Now, if you talk about the estimation of apoptosis, then cytoplasmic cytochrome C, activated caspase, propium oxide, and most important is the annexin 5. Annexin 5 is a marker. Apoptotic cells express phosphatidylserine on the plasma membrane. So these two words are very much interlinked. Very important question. This also is very important point. Now, tunnel staining is positive in apoptosis and negative in necrosis. This is a full form, not much required. In the DNA electrophoresis pattern, what you will see in case of apoptosis, it is a step ladder pattern because of the enzyme endonuclease. All these are very important points. And in case of necrosis, you find a smearing pattern. So you can easily see that this is a smearing pattern and this is the step ladder pattern. So now coming to the most important part, which is the mechanism of apoptosis. Okay, in the mechanism there is basically two phases. One is the initiation phase and one is the execution phase. In the initiation phase, you have the intrinsic pathway, which is the mitochondrial pathway in which caspase 9 is activated, and in the extrinsic pathway, which is the death receptor pathway, the caspases 8 and 10 is going to be activated. So what happens is, in the initiation pathway, there is going to be activation of the caspases. Okay? And in the execution phase, there is going to be degradation of the cells. So this is just the outline, and now keeping in mind this outline, I'm going to take you through the details of the mechanism. This is a very, very important topic. The mitochondrial one is the most difficult to understand, so I'll go slow over here. So apoptosis results from the activation of enzymes called as the caspases, because they are proteases containing cysteine in their active site and cleave proteins after aspartic residues. Very important points. These active caspases is a marker for cell undergoing apoptosis. Again, an important point. So there are two phases. Number one is the initiation phase, where the caspases become active, and the execution phase, where the caspases will trigger the cellular fragmentation. I've already explained this just now. So now there is a very important point, and that is there is something called as the BCL2 family of proteins present in the outer mitochondrial membrane, which regulates the entire process of apoptosis by the mitochondrial pathway. So there are basically three types of molecules or three types of proteins which regulate this entire pathway. So I'm going to first talk about the mitochondrial pathway or the intrinsic pathway of apoptosis. This is a very difficult one, so please pay attention. So there are three molecules, as I said. The first one is the anti-apoptotic ones, the next one is the pro-apoptotic, and the third one is the regulated apoptosis initiators. So just by the name only you can understand this. Anti-apoptotic means the cell will not undergo apoptosis if these molecules are expressed. Pro-apoptotic means obviously the cell will undergo, apoptosis, and regulated apoptosis initiators means now these molecules or these members will initiate the process of apoptosis. So these examples are very, very important, and each of these is an important MCQ and can be asked anytime. So please understand that the mitochondrial pathway is responsible for a process in the physiological and pathological conditions. There is increased permeability of the outer mitochondrial membrane with the release of these pro-apoptotic molecules from the mitochondrial intermembrane space into the cytoplasm. The release of these proteins, that is the cytochrome C, which ultimately will cause the apoptosis. So I will talk about these in details now. Now, anti-apoptotic proteins examples are BCL2, BCLX, MCL1. Okay, these three are very important anti-apoptotic proteins. They have 4 pH domains. Again, an important question. And which are the pro-apoptotic ones? They are the backs and the back, and they have 3 domains. This is again an important question. This channel in the outer mitochondrial membrane will allow the cytochrome C leakage into the intermembranous space. So you can see that these are the channels through which the cytochrome C will come out, and that will ultimately cause the activation of the caspases and apoptosis. I will talk about the details now. And we are left with another very important classification of molecules, that is the regulated initiators. So these will initiate the process of apoptosis. These are BAD, BIM, BID, PUMA, NOXA. Very, very important question. They have 1 pH domain. Remember, they have 1 pH domain, but they are known as BH3 only proteins. So don't get confused. They do have 1 pH domain, but they are known as BH3 only proteins. This is again an important question. So whenever there's going to be cellular stress and damage, these proteins or these initiators will be upregulated and activated, and they will initiate the process of apoptosis. Now, this diagram is a very, very important diagram, a very clearly explained diagram. So what happens is, in a viable cell, whenever there's a survival signal, the cell is functioning normally. This is just a normal cell functioning. There is no apoptosis here. So what kind of molecules will be expressed over here? The anti-apoptotic proteins will be expressed, okay? And there is no leakage of cytochrome C. So this is just a normal cell functioning, surviving cell. Now, whenever there is lack of survival signals or any kind of cell injury, that will activate the sensors. Here we have learned about the sensors, isn't it? So that will activate the sensors, which are the BH3 only proteins. That means these proteins will be activated now, which are the initiators of apoptosis. So once they will be activated, they will now antagonize the BCL2. They will be antagonizing the anti-apoptotic proteins. So ultimately the process is now getting exaggerated. Okay, so once it is being antagonized, now there's going to be activation of the back channel or the pro-apoptotic molecules. Through this channel, there's going to be release of cytochrome C. This cytochrome C, once it comes out into the cytoplasm, it will bind with APAF1, known as apoptosis activating factor 1. Both of this will combine to form something called as the apoptosome. Okay, this apoptosome will now bind to caspase 9, which is the critical initiator caspase of the mitochondrial pathway. Then this caspase 9 will now become active. So the entire aim of this process is to activate the caspase 9. Okay. Now this is the entire process. I hope this makes sense to you. There's another very important point here, that is this SMAC and diablo. What are these things? Now there is some proteins known as the inhibitors of apoptosis. There are some inhibitors of apoptosis, but what happens is SMAC and diablo, they will inhibit the inhibitors of apoptosis, thereby increasing or activating the apoptosis. So please understand that SMAC and diablo will inhibit the IAP, and therefore they will initiate or they will increase the process of apoptosis. So don't get confused. They themselves are not inhibitors of apoptosis. SMAC and diablo, they will exaggerate or they will increase the process of apoptosis. How? By inhibiting the inhibitors of apoptosis. Okay? So this is again an important question. So don't get confused over here. So this is all about it. Now next, so I have just mentioned over here these flow chart, that what happens is, of course, the initiators will come into play, which are the BH3 only domain Waller proteins, which will antagonize the BCL2. The BCL2 was an apoptotic one, so antagonizing this will ultimately cause the increase of the pro-apoptotic molecules, the backs and the back, which will cause leakage of cytochrome C. It will bind now with the APAP, forming the apoptosome, and then the caspase 9 will get activated, ultimately leading to apoptosis. Okay? The next important pathway is the extrinsic or the death receptor initiated pathway. This pathway is initiated by the membrane death receptors. Okay? So what happens is, here there's a death receptor, okay, called as the TNF1 receptor, and it has a protein called as the FAS protein or the CD95. Okay? So this receptor or this FAS receptor will have its own ligand known as the FAS ligand. So both of them will now combine with each other. Okay, I hope this is yes. So you can see over here, this is a T cell. It has got a fast ligand with it, and this is this cell which will undergo apoptosis. So it has got this molecule expressed, which is the fast. Okay, once they will be combining with each other, they will again interact and bind with another molecule known as the FAD molecules. Okay, so what is FAD? Yes, so when the FAS ligand will bind with the FAS, then 3 or more molecules of FAS will be coming together to form a complex unit, and then there it will again bind another adapter protein called as the FAD protein, which is the FAS associated death domain. Okay, so once this entire process, this entire thing, there is forming an entire complex, the FAS ligand, the FAS and the FAD, all these things will form an entire complex. Okay, and then what will happen, they will ultimately cause activation of the pro-caspase into the activated caspase, active caspase number 8. This active caspase, the main aim of this process is to activate the caspases 8 and 10, which is the which will ultimately cause the execution of the apoptosis. Okay, I hope this makes sense to you. Now, this extrinsic apoptosis pathway can be inhibited by a protein called as the FLIP, which binds to pro-caspase 8, thereby blocking the FAD binding. Okay? So this FLIP is again an important question. This can actually cause inhibition of the extrinsic pathway, which binds to pro-caspase 8, and therefore it blocks the FAD binding, so it blocks the apoptosis. Okay? So now this extrinsic and intrinsic pathway will converge into a caspase cascade that will mediate the final phase of apoptosis. It will ultimately cause activation of the caspase 3, 6 and 7, and once these caspases become active, they will be this DNAs will ultimately become enzymatically active, that will ultimately cause the degradation of the cell. So once these cells are degraded, now they have to be removed. Okay, so once these cells are degraded, they are forming apoptotic bodies, and these will be edible by the phagocytes. Now I've already mentioned here before that in the apoptosis the cell membrane remains intact, but this formation of these apoptotic bodies, and somehow or the other the receptor on these membranes gets altered so that they become tasty targets for the phagocytes. So what is that alteration that happens on these membranes? Usually what happens is, in a healthy cell, the phosphatidylserine is present on the inner leaflet of the plasma membrane. Okay? Therefore, this is not recognized by the phagocytes because it is on the inner side in the normal cells. But what happens in apoptotic cell, these phospholipid will flip out and is expressed on the outer membrane, which is recognized by these macrophages. So you understand now that there's flipping of this phosphatidylserine residues, which will flip on the outer side, and that's how the phagocytes recognize this and phagocytose them. Okay? So apoptotic bodies may also become coated with these complements like a C1q, which is again recognized by the phagocytes. This is a very important question. What is efferocytosis? What is efferocytosis? The process of apoptotic cell phagocytosis is called as efferocytosis. So these apoptotic bodies are ultimately getting phagocytosed, right? This process of phagocytosis of these apoptotic bodies are known as efferocytosis, a very important MCQ. I hope that I'm able to explain you all these points. Now coming to something, there are also other mechanisms which is a combination of two mechanisms. So the first one is necroptosis. ठीक है, necroptosis में क्या होता है, necrosis and apoptosis. So why we can't just call it apoptosis, because there is rupture of the plasma membrane, and as we know that in apoptosis the plasma membrane is always intact. So that is why this is necroptosis, and this is sometimes called as the programmed necrosis. It is caspase independent programmed cell death. Okay? So what happens is, again, so there's going to be binding of TNF1 with the receptor, which will ultimately again bind and activate something called as the RIP-K. Okay? Or the receptor interacting protein kinase 1 and 3. The ligation of the TNFR1 or receptor recruits these kinases into a multi-protein complex, and the RIP-K phosphorylates a cytoplasmic protein called as the MLKL. So ultimately, when this complex is getting formed, this MLKL is getting converted, is getting phosphorylated. Okay? And in response to this phosphorylation, this MLKL monomers will assemble into oligomers, and they will translocate from the cytosol into the plasma membrane and cause the plasma membrane disruption, and that is characteristic of necrosis. So ultimately, this MLKL is responsible for the plasma membrane disruption happening in necroptosis. So this is again an important MCQ. Okay? Now the physiological necroptosis happens in the formation of the mammalian bone growth plate. So this is again an important question. Necroptosis is the process that is happening over here. Also in other conditions like steatohepatosis, then acute pancreatitis, etc., and also in cytomegalovirus. Another important point is about the pyroptosis. What is this? This is apoptosis, but it is mediated by interleukin 1, which is which is responsible for the fever. Microbial products that enter the cells are recognized by these cytoplasmic innate immune complexes, and again they form the inflammasome, which activate the caspase 1. Okay, so this again, these are important here. Caspase 1 is getting activated. This will again ultimately cause the release of the inflammatory mediators and the death of the cell. So the next point is the ferroptosis. What is ferroptosis? It is the form of cell death that is triggered when there is excessive intracellular accumulation of iron or reactive oxygen species. So this process is regulated by specific signals, unlike necrosis, and can be prevented by reducing the iron levels, and hence its name. So all of these are important points, can be asked in MCQs also. यहाँ पर this molecule is an important, and RIP1 and 3 are important questions. ठीक है, and plasma membrane is getting disrupted over here. This is again an important question.